Nurse midwives provide critical healthcare services in hospitals, clinics, birth centers, and homes, and present a solution to the crisis in U.S. maternal healthcare outcomes. They have been shown to create better outcomes for mother and child, while at the same time reducing overall healthcare costs. However, midwives in California face obstacles to providing care, and we want that to change. The word midwife means with woman. A certified nurse midwife is an advanced practice registered nurse who goes through at least a master's level of education.
We take care of people through their pregnancy and their birth and their postpartum time. I think people think of midwives as really only being people that attend for births, but we really take care of the person and their whole family through that process.
Support on all levels, like on the emotional, spiritual, physical levels.
Gynecological care, birth control, abortion, pregnancy, postpartum, well woman care, all of that, and works independently as the medical provider.
That was kind of the epitome of midwifery approach and training, is to see the patient really in the context of their life, their family, their social situation. They bring that to the table in a much more broader way than I was trained as a physician, certainly.
Our high rate of interventions is associated with and in part responsible for our high morbidity and mortality rate in this country. Despite spending more money per capita on healthcare than any other country in the world, we have the highest morbidity and mortality rates of all of the developed world.
Midwives and midwifery care actually improves outcomes for birthing people. So you have a lower risk of having a major abdominal surgery or C-section by having midwifery care. And overall, interventions are used intentionally and with indication as opposed to routinely. And the impact of that is significant.
A 2018 study found that increased access to midwifery care is correlated with improved outcomes for families in the form of increased breastfeeding, reduced interventions, increased vaginal birth and vaginal birth after cesarean, and lower neonatal death.
Midwives are known to decrease the number of epidurals. Lower C-section rates, include lower episiotomy rates, include fewer interventions such as artificially rupturing membranes or putting internal monitors on the patient. There are so many benefits that a patient derives from midwifery care.
Despite the clear benefits, why are so few nurse midwives practicing in California? Nurse midwives are prevented from opening practices, obtaining hospital privileges, even treating critical issues like postpartum depression and substance use disorder due to outdated laws requiring physician supervision.
Unfortunately, in California, we're very limited by our ability to have private practice. Physicians, some of them, their hands are also tied because of medical legal reasons, and their malpractice carriers won't allow them to cover as a supervising physician for somebody who's working outside of the hospital.
Physician supervision is not defined in statute. Supervision does not require the physician to ever be present, nor examine the patient, review their charts, or oversee the midwife's care. The supervision requirement does create a hierarchy where physicians have the power to refuse permission to practice and restricts midwives from providing care. It centralizes nurse midwives in areas of the state where physicians already practice, while restricting practice where midwives are needed the most. In short, physician supervision does not enhance safety. It's a discriminatory rule that prevents women from accessing care. California is one of only 4 states in the country that still imposes these restrictions. With maternal health care shortages at a critical high, we need nurse midwives in California, now more than ever.
I have worked in states where midwifery was not supervised, but was independent practice. And I really see no difference in the quality of midwifery practice in places where supervisory limitations don't exist.
Midwives, they really are very complementary to physicians, and it really can free up physicians to have a division of labor where they do things that they are specially trained for and allow midwives to provide what is often superior care to women for natural birth.
There's a current crisis in OBGYN in America today. There are not enough OBGYN doctors to provide the care that's necessary for the women who need that care.
We have 9 counties where there are no obstetric providers, and because physician supervision is required in order for midwives to practice, midwives can't go there either. And if the doctors don't want to go and the midwives aren't allowed to go, who's going to care for those women?
Midwives, by virtue of their ability to provide care for normal pregnancies, and also they can do normal gynecology, can certainly help that particular crisis. And I think they're part of the solution for the decreasing number of OBGYN providers.
We all know the statistics are horrid. African American women and babies are at risk for 3 to 5 to even higher times more morbidity and mortality than white women, regardless of class and economic status, education, any of the other things. We've done so many studies around this, and basically the studies have shown that it's racism.
Racism and toxic stress have huge implications on women's health care when they impact your likelihood of having a premature baby, your likelihood of developing preeclampsia during your pregnancy. The kind of care that you get, the amount of stress you endure during your pregnancy, as well as in everyday life, can have a huge impact on your outcomes.
Midwives are at the forefront of the work around inequities in our healthcare system, both racial inequities, socioeconomic inequities, sexual identification equities. All across the board, I see midwives at the forefront of this battle. I see midwives as the leading edge in dealing with inequities in healthcare.
CNMA also co-sponsored a bill to bring implicit bias training to all people who interact with people during pregnancy.
One of the things I really wish we had, and I know that we need to work harder to achieve, is to bring in more midwives of color, more women of color into midwifery. We especially need Black women to enter this profession. Black women already know the solution. They just need to be at the table and in the driver's seat to steer us and direct us to a better destination.
Midwives bring down overall health costs in a number of ways, one of which is decreasing the number of interventions around birth, decreasing the C-section rate and the cost that's inherent in that. They also, by providing preventive health care, decrease the number of hospitalizations and procedures that need to be done.
Women deserve evidence-based, high-quality, women-centered care, meaning midwifery care, in every part of this state.
We know our scope of practice, we know when we need to co-manage, and we know when we need to transfer care. Other than that, we're fully capable of operating independently, and we have great outcomes.
Midwifery is a very important element of providing care for women. Midwifery is essential to protecting normal birth, and their scope of practice is clearly delineated, and I don't see that there needs to be physician supervision.